Good morning, good afternoon, and good evening. Hello, and welcome to Africa at the Center, Reimagining Development. I'm Aubrey Cody. I'm a managing director with GHV, and I couldn't be more thrilled to have you join us here today for what promises to be a very timely and engaging conversation. This is the fourth webinar of GHV this year in a series. Through these gatherings, we really seek to connect experts across the private, public, and nonprofit sectors so that we are able to examine cross-sectoral issues that we are actively engaged in at GHV and to advance essential conversations in health and development. Today's webinar is a collaboration between GHV and Rachel Toku-Appiah Associates. Our conversation today comes at a pivotal moment against a backdrop of drastically reduced ODA from major donors and U.S. government retractions of USAID funding for Africa and beyond. These abrupt disruptions, along with broader challenges such as climate change and conflict, have intensified calls from African leaders for more sustainable approaches. Today, we are honored to host a very distinguished panel of leaders and experts, bringing together a wealth of experience and insights to this field and to this conversation. I will introduce our moderator, who will frame our conversation and introduce our panelists. And after the panel, we'll have about 15 minutes for Q&A. So please feel free to drop your questions in the chat as the discussion continues. And without further ado, I am very pleased to introduce Rachel Toku-Appiah, who is the founder of Rachel Toku-Appiah Associates. RTA Associates is a strategic consulting firm that is based in Johannesburg and Accra, led by Rachel, who is a development strategist with over 2 decades of experience, including senior advocacy and policy roles at global foundations. While the work of RTA and Associates has a strong African focus, they work globally and have deep global partnerships, including a long-standing partnership with GHV. Rachel, it is an honor for us to collaborate with you today and bring together this panel of experts for such a timely discussion. Thank you so much, and over to you, Rachel.
Thank you, Aubrey, and hello, everyone. So my name is Rachel Toku-Appiah, founder of RTA Associates. It's a real pleasure to host this conversation with GHV and with our distinguished panel. There's been a lot going on in the world over the past few years, and the large US cuts to development funding earlier this year got me thinking. The development system we had before wasn't working optimally and clearly very vulnerable to shocks like this. So why not use the slowdown or the pause caused by these shifts to actually reflect, think through how we can do things better together, and recommend concrete actions that can be implemented? How are Africans themselves thinking about development? How are we prioritizing what needs to be done? And how can we arrive at a new model for development in Africa? So founded earlier this year, RTA and Associates is prioritizing conversations that convert bold policy commitments into practical, country-led plans through advocacy, program design, financing roadmaps, convening, and evidence synthesis to drive sustainable development. Today's short hour is designed to be practical and useful, not theoretical. We want ideas that can be turned into action in boardrooms, in ministries, and in communities. So let me begin by briefly introducing our great panel of speakers, starting with Dr. Jeremy Zungrana. He's the country director for JPIGO in Burkina Faso. And also Dr. Julieta Gosbert-Tibiesiga. She's the executive secretary for the Medical Women Association of Tanzania and is also in the program office for the National School Health and Nutrition Program at the Ministry of Health in Tanzania. We have with us today as well Dr. Intuli Kapologwe, Director General of the East Central and Southern Africa Health Community, and Moki Makura, who's the Executive Director of Africa No Filter. As our countries explore new models of health financing and system resilience, we're interested today in examining how these crises can become catalysts for change and how development actors across sectors can respond with bold, practical, and locally driven solutions. And so to set the stage, I'd like to start by asking Jeremy to help us contextualize this conversation from a practical country perspective, drawing on Burkina Faso's recent experience even before the USAID cuts this year. So Jeremy, Burkina Faso had to adapt quickly when external funding declined. Can you describe the concrete changes the country has made and what early results you're seeing?
Good afternoon, everyone. Thank you very much, Richard. Thank you, GHV and RTI and Associate for inviting us to join you for this very important conversation. That is a sign that we are not waiting to be told, but we are taking the leadership to talk about very important topic like this. My experience sharing will be easy because I'm from Burkina Faso, and we have a concrete case of what happened. Because remember, since 2015, Burkina Faso has been facing terrorist attack and also experienced a government change via a coup that led to many donors cutting their support to Burkina Faso. So this situation obliged the government to adapt quickly to this new situation even before the cut of USAID, the government and other donors. So I just want to mention few area that has been observed. And one thing that I will say on the category 1 is mindset, resetting the mind. Usually we believe that our development, health development, should be done always by external donors. So we saw that Burkina leader adopted a new development paradigm after realizing that they have to count on themselves and not exclusively on external aid. The second thing is changing the narrative from being described as a very poor country. And remember, in our school books, from primary to university, when you start describing Burkina Faso, you will say a very poor landlocked country. So there is no hope that you can succeed to develop yourself unless somebody supports you. So this narrative has been changed across educational level, where they remove this thing and consider Burkina as a country with a rich potential for development. Now come to action. What action was done concretely, at least to make sure that the gap in terms of funding cut has been covered? What we observed was the establishment of a National Solidarity Fund made of voluntary contribution. That means everyone in Burkina contribute to that, including the diaspora, and non-Burkinabe also contributed to that. And it was really amazing to see how much they mobilized. It was a lot of tax on salary, 1% of everyone's salary for those who have salary, and tax on drinks, telephone also contributed to the development. This kind of National Solidarity Fund was able to cover at least the aid reduction. Another thing was what I call sanitizing public wealth management with better planning, rational utilization to save money from abuse. So many people will know that when it's about government wealth, government public thing, people are very, I will say, they're careless, because they will say, it's not for me, it for the government, while we notice that the government is every one of us. So that there was a kind of rationalization. Digitalization also helped to improve productivity and reduce fraud. Can you imagine that the government official can attend 3 meetings, 4 meetings, one person in the same week? So collecting per diem and incurring a lot of charge in terms of transport, etc. So, and zero tolerance for corruption, mismanagement, and fraud, meaning that if you commit any fraud, you have to respond to that. We also see establishment of accountability system where everyone, minister, any official managing public fund have to report periodically on how the money has been used, performance will be assessed, and what was the impact of that money. And the last thing that I want to maybe highlight is the massive investment in human capital development, such as healthcare, education, agriculture, road development, women economic empowerment. And all this was done under from a special initiative from the president office to ensure promptness and timely completion. So with that money collected, we have free care for children and pregnant women, reduce out-of-pocket payment for CT CAM, MRI, and elimination of prior deposit of $1,000 to have access to hemodialysis. The health
really great.
maintained. So I will say that a lot has been done, and the changes that we are seeing is on immunization that has been improved, reduction on malaria prevalence, and people have hope that if we continue in that way, we will be able to improve the health of women, health of children, and the health of everyone. So I will stop here to allow the discussion to continue.
Thank you so much, Jeremy. I think a lot of very clear actions that took place, from changing the mindsets, putting in our own funding, different tools, tax, voluntary, strengthening governance, a lot of lessons to learn from that, and actually starting to see some concrete results. Let me turn to you, Julieta. You've worked with youth networks and ministries, and you were active in recent youth inputs at regional fora. From a youth and inclusion perspective, what does doing development differently look like in practice, particularly in terms of intervention design and domestic financing?
Thank you so much, Rachel, for a very that important question. Part of this very important webinar as the youth representative. So answering the question from a youth and inclusion perspective, doing development differently means putting youth at the center of intervention creation and implementing tailored but adaptable interventions that focus on local context and political realities. So rather than laying on one-size-fits-all approaches, so by doing so, when youth at the center, we won't be just beneficiaries, but as the equal partners, co-creators, and innovators of solutions. So with 1.2 billion youth globally, and nearly 60% of Africa's population is made up of young people aged 25. And this number is estimated to project nearly double to over 830 million by 2050. So this demographic weight is undeniable, but also there are different challenges that we face from unemployment, teenage pregnancies, which the rate is between 18.8% to 24.1% across different countries in Africa. But you cannot leave behind mental health challenges, where depression and anxiety are devastating young minds, to antimicrobial resistance, nutrition challenges, including stunting and overweight and underweight. But what we need as young people is not just recognition, but integration. So in practice, doing development differently requires that interventions are not only designed for youth, but also with youth, meaning ensuring our lived experiences inform priorities, strategies, and monitoring frameworks. So when it comes to domestic financing, I would highlight maybe 3 points to 4, where young people can be actively but practically inclusive. So the first point is youth inclusivity in budget lines. So the government
Julieta, you're on mute.
Okay, so can you hear me?
Yes, we can. Sorry. The 3 points you were making on domestic financing.
So on domestic financing, inclusivity of young people can be done into 3 or 4 ways. So the first point was the youth inclusivity in budget lines. Okay. I meant like governments can earmark funds within health budgets for youth-centered services. For example, sexual reproductive health services, mental health services, and other services. So this ensures young people are part of the civic conversation. So throughout the process, the government should ensure that youth not only have a seat at the table, but also a voice from the initial stages of sector budgeting to the implementation of interventions and budgets. So this increases the ownership of national budgets and motivated to participate actively. But secondly, accountability mechanisms. So youth can be engaged in budget tracking, but also public expenditure reviews to monitor how health funds are used, reducing leakages, and ensuring value for money, maybe through youth advisory boards, but also other youth groups. And thirdly, partnership models. So domestic resources can be aligned with youth-led organizations. And this creates a multiplier effect, whereby the government finances provides the base, and while the youth-led innovations lead the innovation, but also the efficiency, creativity, and community trust. So I have seen youth-led organizations with remarkable ideas struggling to sustain themselves because they lack domestic resources, support, but also a lack of capacity to apply grants and knowledge to manage finances. So in conclusion, so with youth voices, when the youth voices guide design, youth innovations drive delivery, and domestic finances anchor sustainability, we break the cycle of dependence on external funding. But also, this alignment creates a resilient health ecosystem where continuity of services, and this leads to building ownership among the largest demographic group. And lastly, domestic financing prioritizes youth-led or youth-driven programs, it ensures long-term impact, even if after donor funds ends. I submit and thank you for listening.
Thank you so much, Julieta. Basically, we cannot ignore the youth. They form the greater proportion of Africa's population, and they're not just beneficiaries. We need to include them at every single stage and actually have funding earmarked for them. Let me move on to Dr. Ntuli. So Ntuli, it would be great to hear your perspective from a regional level. What were the most important outcomes from the recent East, Central, and Southern Africa health communities meeting in Mauritius on best practices and the Directors Joint Consultative Committee? And, are any of these outcomes relevant to how we finance and manage health differently?
Well, thank you very much, Rachel and Associate, and thank you very much to GHV. It's such an opportune time, and indeed it's a privilege for East, Central, and Southern Africa community to be part of this very important webinar. Indeed, in August, we had the 15th Best Practice Forum and the 31st Directors Joint Consultative Committee, which was held in Port Louis in Mauritius. And the theme was enhancing health system for equity, resilience, and sustainability. And much of the discussions were around sustainable financing. And we were able to rally through a number of the documents that have been developed by the continent, Africa, through the African Union, Africa CDC, but some of the declarations, including the Abuja Declaration of 2001, which requires the member states to be able to allocate 15% of its budget being directed to health. But apart from that, we have had a number of other instruments which came into being, one of which is the Lusaka Agenda. And the Lusaka Agenda, they clearly stipulated about 5 pillars, one of which is on the sustainable financing. So we were able to discuss different models around sustainable financing, from domestic financing, going to the blended financing, where some of the countries, they are employing blended financing, where you can have two partners agreeing on the common goal to be able to implement together. And some of the countries which they have succeeded very well with that, we have Zambia, Malawi, Kenya, and Tanzania, which to the great extent, they manage to do so. But other countries like Zimbabwe and Mauritius, they have heavily invested into the public-private partnership. So we have players from the private working the public sector together in addressing a number of health, nutrition, and social welfare challenges. And this is working very well. But the other component under the Lusaka agenda, and it's also present in the new public health order, is on the partnership and collaboration. In the meeting of Best Practice Forum, we did discuss very well how are we going to sustain partnership and collaboration within the continent Africa, or global south, or global south and global north. And one of the very important strategy that came out of all the discussions that we had, it was on the health diplomacy, the intersection between the public health and international relations through discussion, through negotiations and collaboration. We feel that this is a high time that we can have partnership through countries to countries, or between countries and countries, or continent and continent. Through this partnership, you can help us to be able to leverage whatever resources that are available, because the resources are scarce. Therefore, the only way is having different bodies or parties working together to be able to implement the common initiative or the common strategy. So in that gathering, we all agree that the new currency right now is partnership and collaboration. We need to invest in partnership and collaboration, and health diplomacy remains to be key. But the other thing which really helped us to be able to discuss and also emerges one of the thematic areas was the issue of supply chain management for health commodities and supplies. Africa is a big economy. So being the big economy, we need to invest into making sure that commodities are available throughout. And how? We need to be able to have the economies of scales, the local manufacturing capacity. 90% of vaccines and medicines are imported from abroad. So Africa needs to be able to invest locally so that they can be able to save. But apart from that, the issue of pooled procurement, having individual countries to go and procure, that is not beneficial. But having countries working together, pooling all the resources and procuring health commodities and supplies, that's also working very well. So these were
That's
some
really
of the
great.
which really surfaced in our discussions in Port Louis and Mauritius.
Great. No, thank you so much. I think it's really good to see some of the things that are critical to do at a regional level together, and then at a country level too, and just hearing about some of the innovations. I'll actually come back to that later and give you more time to expand as we talk about, pharmaceutical manufacturing on the continent. So I think that would be a good point to delve into that more. We've been talking a lot about the financing aspect. We've spoken about partnerships. There's been talk about strengthening governance, but a lot of the conversation in the development space really is still framed around aid, right? About the money. So Moki, I believe that changing the stories, the communications around development, is something that we also need to look at. How can changing the stories and the narrative shift us as Africa from dependency to agency and help us reimagine development?
Thanks, Rachel. I think it's a great question, and it's ironic at the end, because it's often the thing that we least think about, how we actually frame development. But I want to start with a quick story. I was on a call. There was a group of people who were all working in the development space, and we were all asked to react to the USAID cuts, how it was affecting us. There was a lady from, let's just say she was from Ghana, who ran an orphanage, and she literally came on, she goes, I need help, they've cut my funding, my orphanage is going to close down. Tell me where I can replace this money. She really came from a space of victim, like, she's not going to be able to survive. Later on in the conversation, we asked her, has she shut down the orphanage? Have any children gone unfed for any period of time? It turned out that she had a social enterprise business that was sustaining the orphanage. She was actually generating revenue, but she didn't see it like that. But by the time she finished telling that story, we were all like, wow, look at what you've achieved. How much are you totally really dependent on foreign funding? And I was so much more inclined to support her because she felt like she had agency. She was making the change. She was being innovative in her own space. And that reaction from me shows when we go to people, victim mentality, cap in hand, begging for aid, we get treated badly. And
Yes.
the balance is unequal. We need to go from a place of agency. We are not dependent. We're not a broken continent. And that's why I know that stories matter. If we tell the story of how we as Africans are changing our communities, changing our countries, because there is a lot of progress. It's not just Burkina Faso. There's Ghana. Ghana recently launched the Accra Reset, Malawi, Nigeria. There's lots of countries that are doing that, but we don't hear about that. What we do hear when USAID closed, or Al Jazeera, CNN, BBC, it was all stories of victims. I mean, if I looked anywhere, it was the victims that were going to die in Kenya and South Africa because the antiretrovirals were no longer available. And I'm not belittling the fact that people might have lost their lives and people may have died. What I'm saying is that there's a different story to tell if we want to have impact. And that story is one of progress. There's a huge amount of progress on the continent that largely goes unnoticed. I shouldn't have to sit on a webinar to hear about Burkina Faso's story, right? I shouldn't have to dig deep to find who else have done. I had to get an intern in my office to help me dig out stories that are that we just don't focus on them. And it brings me to the point that narrative matters. As an organization, that is what I do. African No Filter is set up to change the narrative about Africa. And one of the things we did when we first started was try to identify what are these narratives. They're so persistent. It is that Africa is always seen through the lens of poverty, that we are a corrupt continent, constant conflict, poor leaders, and we're just problematic disease everywhere. The reality is that there is opportunity on this continent, huge amounts of opportunity to correct every single one of those challenges that we have. There is huge amounts of progress, and there is innovation that we don't even recognize until somebody comes to tell us that it's innovative. So I think the most important thing for me is that, yes, in 2025 onwards, we have got to change this broken model. USAID forced the conversation. That's all they did. And we're pegging a lot of this on USAID. Europe has been dropping its ODA for a long time. Go to most countries. I right now sit in London. The debate around aid, ODA, is huge. Nobody wants to give to us. The electorate in all of these European countries don't want to give aid. We don't want to receive aid, right? We want partnership. So on both sides, things are changing. So there is no better time now than to reinvent it. 2025, I'd love to see a model where we don't even use the word aid, right? Because no country has ever developed on the back of aid alone. We need to talk about trade. We need to talk about investment. We need to talk about different types of financing. And, all of these sources, government, philanthropy, private sector, they all need populations to thrive. Government needs to raise taxes to do this. So we need to have a conversation with ourselves as Africans, right? If we are not participating in our own development, who else will do it for us? So there's a huge conversation that we as Africans need to have. And Jeremy made a really good point when he said it's a mindset change. We absolutely need to change our mindsets from one of we are dependent, this continent is broken, that we don't have the agency. And there are pockets of this new agency around. You see it everywhere. You saw it in the youth protests in Kenya when the young people went out and said, we have the agency to create the change we want. And they did. It's happening. Right. So now is a perfect moment for us to reinvent aid as we need it.
I couldn't agree more, Moki. Thank you. And you tied it up very nicely with Jeremy's points, how powerful narrative is and what we believe we're capable of. So at this point, let me shift the conversation a bit from the context and actually move to some concrete design and scaling. So I'll start with Julieta now. Julieta, from your work on adolescent health, what programmatic design changes are practical and cost-effective for ensuring that services meet young people's needs?
Okay, thank you so much, Rachel. So I've attended several human-centered design workshops, which we gathered stakeholders engaging themselves in adolescent health. So also adolescents were also stakeholders in that human-centered design workshop. So what outstanding like most among those adolescents, they gave out really good points for them to be attended so as their needs to be met. So the first point was they don't need youth-friendly services in terms of the flexibility of clinic hours. They are, for example, those out of school young people, they have a lot of economic activity that they're engaging themselves from Monday to Friday. So they would like maybe during weekends, some clinic hours could be special for them so as to be attended freely, but also friendly, because, during the weekends, maybe the queue is not that much as other weekdays. So that's the first thing. But the second thing, they would like to have young, vibrant healthcare workers. They don't want to go to the hospital and find maybe 50 to 60 years old healthcare worker attending a young person. So they would like to be attended with young healthcare workers where both can speak a youth language in a way to be to understand each other, but also easily to be understood and attended in a young way they would like to be attended. But they also said about the peer educators model. When we cannot reach all the young people across, maybe in Tanzania, I can say, in case of my country, but through using peer educators, it's a very effective and sustainable way of designing adolescent health. So those peer educators can be capacitated, given basic skills on maybe sexual reproductive health services or mental health, even also nutrition, so themselves can go far beyond and attend even underserved or marginalized communities, adolescents. And lastly, they said they would like such health services or interventions to be integrated into digital platforms. You know, as Gen Z and young people, we use more of social medias. So they pointed out that maybe these services or maybe educational materials could be updated into the social media platforms, where instead of wasting their time, maybe engaging themselves into unrightful informations, they can be engaging themselves into right information, particularly on health. And they said, lastly, accurate health information should be given in a confidential way. They don't want to be shouted at. Like when you counsel them, they need to be talked like with empathy and sympathy to be understood and attended in a good way. Thank you so much.
Great. No, thank you, Julieta, for those really concrete, practical examples of how we can improve service. So just reminding us, I want to make sure we don't shortchange our audience. I see lots of questions popping up in the chat. So if we could just try and give very brief responses so we give them enough time. Let me move to you, Ntuli. What role do regional bodies have in sustaining the shifts that we are seeing in how we finance and manage health? If you could just delve into that a bit.
Thank you very much, Rachel. So what we have done as EXA is studying the different systems, especially the financing models among the member states and non-member states. And we are using what we call peer-to-peer learning. What works in Malawi, we borrow it to be implemented in Uganda, and what works in Uganda can be employed and implemented in Zimbabwe. So we started by conducting a thorough landscape analysis, and now we know each country's gap in terms of finances. And from there, then, we went into studying the different models. And you find there are some of the countries, they have already started to implement universal health insurance. So we take that one and try to introduce as a policy to the countries that they haven't started yet. But also there are some of the initiatives like the community health funding, which works very well for the people who are in the informal sector. And this is also we use as one of the approaches to help the member states to try this system so that they can bridge the financing gap that exists. But however, one must be known, for us to be able to effectively use whatever resources that we have, we need to allocate efficiently, and also we need to employ accountability in whatever resources that are available. I quite agree with what Moki and Jeremy said. The issue of mindset shift is quite very key for us to be able to move forward. So EXA, what is done, we conducted the analysis, we shared with the different stakeholders, and our supreme body for all the decisions at the region are the Health Ministers Conference. So we use this Ministers Conference to get their buy-in, but also to get resolutions to be implemented among the member states. So this is how we as a regional body we have been able to approach, but the issue of partnership and the collaboration is key, especially among the member states, but also having south-to-south collaboration and south-to-north collaboration through health diplomacy.
Great. No, thank you so much. I like how you are leveraging the bird's eye view you have to just compile information, leveraging that evidence to help countries and to enable them to learn from each other in terms of what works. So moving on to you, Moki, and I have lots of questions for you. I'd love to ask, what are some of the ways we can do storytelling differently? But for now, let me just ask, how do we ensure that we don't just focus on how donors portray their contributions to Africa's development? What can Africans themselves do to ensure we project the progress and innovation happening here? How can more people do what Africa No Filter is doing, basically?
Well,
Thank you.
I think the most important thing is that we need to change the stories that we tell. You know, at Africa No Filter, we talk a lot about what we want. It's better representation for Africa, better representation for each of our countries on the global stage, but also within our own countries. So we talk about we want better stories and we want stories to be told better, because better stories mean we have more stories of the progress we're making, the opportunities that are out there, the innovations that we see every day, but we don't even notice that they are innovations. We need to tell those stories deliberately. We need to put them onto platforms where they are seen. I saw somebody put something in the chat about the platforms. Unfortunate thing, Africa doesn't own any of these significant platforms, Twitter, you know, even Netflix, all of these platforms which we consume. We are consumers. We need to start owning and start buying, purchasing, consuming our own brands. You know, we recently did a little exercise at Africa No Filter with our own team, asking various questions about how really African are you? What brands are you wearing? What brands do you buy? Where do you invest your money? Where do you go to university? Where do you go to school, right? Where are you investing your money? How African really are we? And if you ask yourself that question, you realize that actually we are giving away a lot. You know, we consume other people's media. So one of the things we need to do is own the media, and we need to tell those stories. The second thing we need to do is we need to tell stories better. There are stories that need to be told, difficult stories. Media has a role to hold governments accountable. There is corruption in Africa, like there is everywhere else. And media and, you know, our storytellers have a role to point that out. But how do we tell those stories? Who do we make the heroes, right? You know, there's a thing called solutions journalism. When you look at what's working as opposed to what's not working. And I'll give you this quick example. I was at a conference. There are many, many conferences on the continent. And I sat and I listened all day, high-level speakers talking about the problems we face, the challenges, the things that need to be done. We're so close. We're so close. But the problem was, if I had just arrived in this hall from outer space, I had no context, I would think that this continent, this Africa they're talking about, was an absolute mess, chaotic, nothing worked, problem child, you just wanted to put it away. Yeah. The reality is we need to start focusing on what is working. We need to change our language. We need to speak positively and highlight the things, the many, many, many things that are working on the continent. And that's how we change the stories. So one of the things we're doing, just my last point, is that Africa No Filter, we are launching something called Opportunity Africa. It's a campaign we want to do to rebrand the continent, to actually change mindsets. And our work is aimed primarily at us as Africans, because the mindset shift needs to come from us. Once we have got that, we have 1 billion ambassadors who can go to the world and change the rest of the world, but we need to start with ourselves. We need to create the Africa dream. There's an American dream. There's even a European dream. You want to go over and, you know, end up at the bottom of an ocean on the way to Europe. But what have we sold ourselves? What have we sold ourselves, right? So there's a lot of work we need to do, but it just starts with seeing things through a different lens. And that's something within our power. That's something within the power of every single person on this call, attending this webinar. We can change the way we see Africa.
Thank you, Moki. Very powerful. Don't think there's anything further to add to that. It's up to us. We need to change how we talk about ourselves and the stories we tell. So Jeremy, you know, Burkina Faso has done a lot of great things. And lots of us are excited about the changes taking place there. But we know it's not all smooth sailing. This work is challenging. And so can you tell us what are some of the challenges that you may have encountered or that remain to be addressed in Burkina Faso's development trajectory?
1545. Thank you so much, Rachel. I think you all mentioned probably what could be considered as challenges for Africa and for Burkina Faso, where I can see a kind of delay in many things. So the mindset thing is remain number one, because if you have good leaders who want these people to follow and start thinking differently, some people who are very conservative will say, I prefer, you know, the the past than the future that you are describing that is not concrete. So I think we still need to develop leaders who will be able to have a clear vision on what needs to be done for the people. So this is a kind of internal challenges that we have. So it will take time to educate our people, starting from young generation, for them to understand, even the old generation also to adapt to the new reset, because it's not easy thing. The second challenge is, even though we have kind of resources, these resources need to be developed. They are still in the position or in the manner that you cannot catch up with European. We are not, or Western, I will say, we are not competing with anybody. We just want to start developing ourselves. We want to be part of something, but also want to change the narrative by more acting, because we say action speak louder than word, and you cannot do action without means. That means you still need support, but not in the way you usually receive without even thinking if it will help you or not. The real aid is the aid that will help to kill the aid. I think one of the leaders say that, and I don't have all the detail to quote, but any kind of aid that we are planning to receive need to have a number one purpose to kill the aid, or you transfer it to the one who needs. I think that will be something that will help all of us. And the second thing, we know our disease doesn't need visa to travel. So our challenge here is to see our health problem within our own country. We have to be more, broader, and have a global perspective in addressing some diseases, so that we can share, we can mutualize, our resources, we can mutualize information, and that can help. But we still have challenges, because sometimes what is happening in your neighbor country, because they are not sharing, you don't learn from them. South to South is something that Tuli mentioned that need to be promoted. These are still challenges, and we need to put, I will say, we need to be realistic on what we can do, because you cannot catch up and become high developed when you don't have the means for that. So I'm going to stop here.
Right.
Yeah.
Thank you so much, Jeremy. And so now at this point, we want to shift to the Q&A. Thank you so much to everyone for joining us today. We will do our best to answer as many of the questions that have been asked as possible. But this is the first in a series of webinars, and we hope to continue the engagement with you as we think through how to do our development differently. So there was a question for you, Moki. Shifting the media consumption to change narratives, you made that point very powerfully. And we noted that many of the media platforms are not actually owned by us. How do we create our own platforms and then shift traffic to those whom we seek to engage?
Yeah, I mean, I'll answer this quickly. Media is expensive, but it's a critical part of any developing economy. We need to recognize that media brands, influential media brands, have grown over time. We're on the back foot already with Africa, but we need to invest in our media. When I look at development, if you look at the amount of money that goes into health versus goes into media, it's minuscule. And I'm not saying that, media needs to have the same level of investment, but media plays a critical role. And everybody who invests in media, they often tend to invest in media for their own agenda. It's never media for media's sake. So we need to build a resilient media environment, or we need to create an enabling environment, or we need to create policies to support the media and entertainment sector, because they are the most influential tools that anyone can use. Look at how it's being used in America. So and I really honestly feel that if we start consuming our own content on our own platforms, we will make a huge difference. Everyone quotes this figure: by 2050, is that 1 in 5 or 1 in 4 people will be African? That's a phenomenal force that we have. Somebody also asked about the role of the AFCFTA. Absolutely critical, because we are more powerful as a single unit than we are as 54, 55 different countries. So we need to start consuming, and that's a deliberate effort. Watch Nollywood, watch Kannywood, watch African movies, consume our content. That's what it takes. That's what it takes. Because it's a market. Media is a business, right? So people need to consume in order for media owners to make the money. So I don't know how else to say it, but we need to start investing in startups and the business cycle, and we need to consume.
Excellent. Thank you for that. Dr. Ntuli, you spoke a lot about, at the regional level, how you're helping countries, but I want to make sure I'm picking up on this question because it appeared in the chat. How are regional bodies supporting countries in accelerating government financing for health and social welfare? You've already given some examples, so perhaps you can expand on what are some of the tangible milestones that you feel have been achieved so far.
Yeah, that's a very important and indeed it's a very interesting question. So some of the examples, we had some innovations which we used blended financing, one of which was called Mama. This is an emergency transportation for women trying to reduce the waiting time, but at the same time to reduce the delays to reach to healthcare facility. So it was innovated in Tanzania, but later it was scaled up to Lesotho, and now it's about to start in Malawi. It's using a blended financing where you have the government, where you have another partner from the private space working together to transport mothers and newborns who go to the facilities so that they can receive healthcare services timely. That's one. Two, there is another innovation which is called Safer Births Band of Care, which is started in one of the countries within the EXA region. Now it has been scaled up to about 5 countries. So this is some of the examples that EXA has tried to create an enabling environment where you have the different countries working together to address a common challenge. Maybe, for instance, one of the challenges that we are having commonly across the EXA region is high maternal mortalities, which is above 500 per 1,000 live births. But how do we manage to learn from some of the countries which are performing better as compared to the other? And this is the model which we would really want to employ, because some of the things where Africa learn abroad becomes very challenging to implement in our context. But learning something from Uganda, learning something from Mozambique or Malawi, it is within our context. And that's why also we had a partnership with the government of Burkina Faso in trying to learn some of the healthcare system initiatives. What works here being implemented in Burkina Faso. So this is what we are trying to encourage so that we can have a feasible and a thriving initiative in the continent.
Excellent. No, thank you. In 30 seconds, because I know there are many on this call that want to know, pharmaceutical manufacturing on the continent, sorting out supply chains. Can we do it? How are people at the regional level thinking about it? Just very briefly, we can expand on it in a future conversation because I know it's a hot topic. But that's one of the questions that I see around supply chain and local or manufacturing on the continent. Or maybe just to clarify, it's what are the opportunities that we see for medical supply production on the continent? And what do we have to do perhaps to supply chains to make that happen?
That's a very good question. So now the good thing is that African Union established what we call AMA, African Medicine Agency, which is headquartered in Kigali, Rwanda, helping to coordinate and mobilize African member states to be able to come up with the local manufacturing capacities. And this is one of the things or tools that is very important, that we need to have an organization or a framework that help to coordinate. Otherwise, you might create competition within the Africa continent. So now we know that Kenya is manufacturing a vaccine. We know
Yes.
South Africa is manufacturing another set of medicines. So this is a coordination that is needed within the continent of Africa, because our economy is huge, our market is big. All what's needed is now the coordination, also having the regulatory mechanism to make sure that the local manufacturing capacity that we envision to have, it should be able to discharge its mandate accordingly. So this is one of the things that has been done very, very well. The other thing is on the pooled procurement. Here we have SADC, who are frontiering the pooled procurement. East Africa Community and EXA are also into that, where we try to engage different countries that are to procure a certain commodity or a therapeutic, so that they can all the resources can be pulled together and be able to procure. In so doing, there's a lot of saving and also economies of scales. So this is one of the approaches that helps very well, one, to bring solidarity among the African countries, but secondly, to be able to save costs, which initially we as the continent or member states within the continent Africa, we were competing to each other. So these two has helped a lot to be able to strengthen the supply chain for health commodities and supplies in the continent Africa.
Thank you. Thank you. So we're almost at time. Just 30 seconds, please. Julieta, what one piece of advice would you give to an American or European NGO leader in terms of what role they can play in this transformation of how we do development differently? Any advice?
Thank you so much, Rachel. So the advice is we should be look like partners and not beneficiaries. So collaborations is the backbone of everything, and not like receivers, but collaborating with them to make sure that we are both on the same page. Thank you so much.
Great, thank you so much. So Jeremy, also in 30 seconds, because we really are pressed for time, if you could respond to the same question. What's the one piece of advice?
I will say everyone has a potential. Look for it and support to develop. You will win double.
Excellent. Thank you so much. I think with such really clear and strong points, we leave this with both great insights as well as some concrete actions that we can take. Over to you, Aubrey. Thanks.
Thank you all for joining us. I want to say a special thanks to Rachel and to our esteemed panelists, Dr. Julieta, Dr. Jeremy Moki, and Dr. Ntuli. We greatly appreciate you taking the time to lead this discussion with us and for sharing your thoughtful insights. I hope for our audience that's joined us here today that the discussion has been informative and has advanced your own thinking about how we are all collectively reimagining development on the continent and beyond. And if you missed any part of this webinar, we will have a recording. We will share that with you by email. Please feel free to share it with your networks. If you're interested in learning more about GHV and Rachel Toku-Appiah Associates and how you could work with us, please see our information on the slide and please reach out. I have one last ask for those of you who are still with us. We have a very quick survey that we will be popping up on your screen. It's only short, four questions. We would really appreciate your feedback. It helps us at GHV to continue learning and growing as we go. And we hope you will join us for our next webinar in a few months And once again, thank you so much to our moderator and panelists and to our audience. Thank you for joining us today.